Hi, I'm Cheryl Kraft of HealthyWomen.org. Stay tuned as Dr. Ariel Kavar, leading dermatologist, answers all our most pressing questions about cosmetic procedures.
The most common procedures that patients come in for are improving their skin complexion, whether it's from sun damage, brown spots, or discoloration, enlarged capillaries or redness. Obviously, wrinkles and skin folds, whether it's crow's feet or lip lines, and just the general appearance of their skin. Injectable products that are approved by the FDA in the United States are extremely safe. They go through rigorous testing here for many years, and now we have a wide variety of injectables that we can use that are FDA approved. The biggest adverse effect when you're performing injectables, whether it's Botox or filler injections, is bruising from the needle injection itself. And so any medication that would increase your potential to bruise, whether it be aspirin or an anti-inflammatory, should be discontinued, ideally 7 to 10 days before the procedure. There are a number of fillers that are FDA approved in the United States. The most common filler, however, that we use today are the hyaluronic acids. And what's wonderful about the hyaluronic acids is that there's no protein in them. Hyaluronic acid is actually a sugar gel, and sugar gel that makes up all of our cells. And when we inject it, it's a natural body substance. In addition, we have an enzyme that can break it down. And so if for some reason it's injected and a patient doesn't like the way it looks, we can then inject an enzyme and dissolve it. So they're extremely safe. There's no topical alternative right now that will achieve the same effects as injecting botulinum toxin, whether it's Botox or the newer botulinum toxin, which is Dysport, or the filler injections, which include hyaluronic acids as well as some other fillers such as Sculptra and Radiesse. Age spots can be treated with lasers. We have lasers that remove brown freckles or age spots. That's one method. There are lasers that actually peel the skin. There are intense pulse lights that remove brown spots as well. It just depends on the type of age spots that the individual has. When seeking a dermatologist for your procedure, you should make sure that your dermatologist is board certified and that they have experience in cosmetic procedures. So if you're going to have a laser procedure, make sure the dermatologist was trained in laser and that they have the laser on site in their office, that they're not renting the machine once a month or once every 2 months, and they're actually performing the procedure themselves. The best thing you can do to improve your appearance is to protect your skin from sun damage by wearing sunscreen every day and taking sun protective measures in terms of hats and not being out during the peak hours, and using good skincare regimen, which includes antioxidants to reverse free radical damage from the sun and pollutants, good moisturization, and exfoliation. One of the biggest problems in mature skin is that the skin does not exfoliate as efficiently as it does in a child or an adolescent. And that's why it's important to use either glycolic acids or scrubs or some method to exfoliate your skin.
Thanks so much, Dr. Kavar, for all the interesting and helpful information. For more, visit HealthyWomen.org.